everybody. Good day. My name is Alanna Ebigbo.
My name is Christoph Römmele. We are from the Department of Gastroenterology at the University Hospital of Augsburg, Germany.
And we are here to talk briefly about our study titled Cost Effectiveness Analysis of SARS-CoV-2 Infection Prevention Strategies, including pre-endoscopic virus testing and use of high-risk personal protective equipment. So we would like to explain to you why we did this study and what our motivation was. Christoph, as you know, in most parts of Europe, the first peak of the pandemic in Germany in March took us unawares. Effective infection prevention strategies were not sufficiently in place at that time. However, with time, we all developed extensive infection prevention strategies for healthcare workers in the endoscopy unit, including pre-endoscopy testing as well as use of high-risk personal protective equipment, PPE. The problem was that the dynamic nature of the pandemic brought us to think about the cost effectiveness of such strategies. We observed that there were enormous regional differences as regards prevalence rates, as well as differences between various phases of the pandemic. These various phases of the pandemic are obvious now that the second wave of the pandemic is hitting us in Germany and spreading across almost all European countries. So, Christoph, can you briefly explain what our hypothesis was?
Okay, so our hypothesis was to use a theoretical model with 10,000 asymptomatic patients in a high volume center for endoscopy, and to demonstrate the different cost effectiveness of different strategies using personal protective equipment and different testing strategies like rapid point of care tests or standard PCR tests. And then we wanted to examine which strategy is the most cost effective for different prevalence rates and correlate them with the situation we had in the first wave in Germany.
Exactly. And for this purpose, we compared the so-called ISSN scores, incremental cost effectiveness ratios, but we also calculated endoscopy costs per endoscopy of 8 different infection prevention strategies. And we compared these different prevention strategies to a basic form of infection prevention with a surgical mask and no routine pre-endoscopic test. So, Christoph, can you briefly tell us what the outcome was and why this outcome is so important?
Yeah, so as we said already, it is a theoretical model, so therefore we used a Monte Carlo simulation over 1,000 iterations for different prevalence rates. We used 0.01%, 0.1%, 1%, and 5%. And then we showed the different recommendations and simulated it with the different strategies. And we could show that the pre-endoscopy testing and the use of high-risk personal protective equipment correlates or depends strongly on the prevalence rate of the infection. So to say it in short, you could say that to use high-risk PPE is a good recommendation in a pandemic situation, but the cost effectiveness is increasing for pre-endoscopic testing and for the use of these protective equipment if the prevalence rate is higher.
So I think this outcome is important because the availability of resources, including high-risk PPE or routine endoscopy testing, may be lacking, and so needs to be weighed against the risk of infection. The cost effectiveness principle, we think, must be taken into consideration, especially when we recall the scarcity of PPE, which we experienced globally during the first wave of the pandemic. So our next steps are to evaluate the accuracy of such point-of-care tests, such as the quick antigen tests, in our endoscopy unit in a live endoscopy setting. And we have been using these point-of-care antigen tests combined with PCR tests in all our asymptomatic patients presenting to our unit. So our next steps are to evaluate the cost effectiveness of such tests. So in conclusion, we hope our study gives some theoretical insight into the cost effectiveness models for infection prevention, of healthcare workers during upcoming waves of the pandemic. And also, we should remind ourselves that resources should be spared during lower prevalence phases of the pandemic. Thank you.
Thank you very much.